So to prevent an asthma exacerbation, we need to avoid anything that can make that airway angry, and that includes avoiding those triggers. So the NCLEX may try to trick you and tell you to teach caregivers to sweep daily. We don't want them to sweep because that can reintroduce allergens like pollen and dust into the air. Instead, they should be wet mopping and using air filters. They also need to close windows when the pollen count is high, and clients need to avoid all kinds of smoke exposure like people smoking or campfires. Then these clients need to prevent infection by getting their pneumococcal and annual flu vaccines. Medication teaching is really important for asthma control. So these medications are prescribed in a stepwise approach based on asthma severity. So if they need more coverage, they need to go up the stairs. And if they are doing better, their asthma is well controlled, they go down the stairs. The NCLEX may ask you about these two main categories for asthma meds, so pay attention. Rescue medications are for asthma exacerbations. These are things like albuterol. Then we see maintenance medications for long-term asthma control, things like montelukast. So remember those two main features of that angry airway. It bronchospasms and gets inflamed. We need to treat that bronchospasm by bronchodilating. We can do this with our short and long-acting beta agonists like albuterol and formoterol. Theophylline is also used for this, and it has a narrow therapeutic range, so we need to monitor for signs of toxicity like vomiting and dysrhythmias. Then we need to address that inflammation by decreasing inflammation with those anti-inflammatories, like inhaled corticosteroids like fluticasone and budesonide, and then our mast cell stabilizers like cromolyn sodium, and our leukotriene receptor antagonists like montelukast. So this is our next star point. We want to use albuterol always first for asthma exacerbations. That A for albuterol, think A is the first letter of the alphabet, so we give it first. Why do we use albuterol? Because it's a short-acting beta agonist, so it works really quickly to open those airways, and it also helps improve delivery of subsequent medications. We also teach do not give long-acting beta agonists alone for asthma exacerbation. Remember, these are long-acting beta agonists, so they're slow to bronchodilate. Therefore, it can increase risk for complications and death.